In this segment, we will be talking specifics about two very different surgeries of the eye. Dr. Paul McConnell and Dr. Mark Shields, both ophthalmologists and both surgeons for I1 at the Stanton location. Welcome, gentlemen.
Thank you.
Let's start with what you do a lot of the time, Dr. McConnell, which is cataract surgery. It seems to me that that has really changed over the years. Is the procedure, the time involved, the recovery time much different than it used to be?
You know, that is absolutely true. The recovery period is much faster than it used to be. There was a time, 30 years ago where folks remember patients spending a prolonged period of time in the hospital in sandbags in a face-down position. However, that has changed a great deal. Now the recovery is very quick. It's outpatient surgery, meaning you go to the hospital and come home both in the same day. And so the vision recovery is actually very fast typically also. Sometimes patients see very well one day after surgery, and if not, usually they're in pretty good shape within a few days or at least a week after the surgery. So the recovery is much faster these days.
What causes cataract? I mean, is it heredity? Is it just something that happens with age?
Well, the most common cause of cataracts is age. Birthdays is the way I like to put it. So I tell folks that come in, if you have enough birthdays, you're going to get a cataract. You can't really avoid them. And so that is the most common cause. However, there are some types of medical conditions that are associated with the development of cataracts, and those medical conditions are sometimes hereditary, but for the most part, it's birthdays.
And what type of symptoms might someone be experiencing that might be an indicator that they have a cataract?
Most folks will just really overall have a decrease in the quality of vision. They might find that they're having more difficulty with reading, even watching the ticker on television, reading the view guide on television, that sort of thing will become more difficult just gradually over time. Another common symptom of cataracts are glare and halo. While driving at night, patients will often experience a glare from the oncoming headlights, even in the rearview mirror, that sort of thing, and that's a very common complaint or symptom of cataracts.
And Dr. Shields, what you do predominantly is plastic surgery ophthalmology. How does that differ from general ophthalmology?
Yeah, plastic surgery, or what we call oculoplastic surgery, is different from general ophthalmology in that what I deal with is primarily surgery of the eyelids. So if you have a droopy lid, or if your lower lids are turned out or turned in, or if you have, say, a skin cancer or some type of eyelid lesion, skin lesion around the eye, that's the type of thing that I deal with. I also deal with tearing around the eye and tumors around the eye, as well as trauma around the eye. So we deal with a variety of things.
And is the majority of the surgeries that you do predominantly to deal with some sort of vision problem like you were describing, or are any of the surgeries purely cosmetic?
Yeah, there are some purely cosmetic surgeries. Most of the surgeries that we deal with, though, are what we call functional, or ones that insurance will pay for and will help your vision. It's the analogy that I oftentimes use is it's kind of like the shade on a window. And what we do is we lift the shade by lifting the lids. And that's one of the main surgeries that we do.
And as people age, just kind of walk me through the decades of what people need to bear in mind in terms of having regular eye exams. How frequent should they be?
One of the first things that start to happen is in the 40s, the decade of the 40s, people often lose their ability to see up close. And so that is when people sometimes will require over-the-counter readers, even if they haven't required.
They just need those longer arms.
Exactly. And then in the 50s and 60s, they start to develop cataracts. We typically ask patients to come in, every year or two in the 40s and 50s, and depending on other changes, 50s, 60s, maybe every year if they're starting to develop cataracts or other issues that need to be followed more closely.
We've been talking about surgery today, but you guys with I1 have a number of locations and you do everything. If it has to do with the eyes, you guys just about do it. Would you rattle off your locations and talk about all of the just things that you do besides surgery of the eye?
Sure. We have a Stanton location, or some of the locals know it, the Verona location, because it's right on the city line. We also have a Fishersville location, which is probably our busiest office, and there we have our refractive surgeon, Dr. Patel. We have our retina surgeon, Dr. Tiedemann, who deals with a lot of things like macular degeneration, diabetes, retinal detachments. We have a general ophthalmologist there, Dr. Barnes. We have optometrists there. We have opticians there to help with your glasses. We have many of those things at our Stanton location as well. We have a Waynesboro location where you can find a lot of the general ophthalmology services as they relate to cataracts and glaucoma, macular degeneration, as well as glasses. And then we have a Stewart's Draft location with Dr. Smith. We have a relatively new location in the Lexington area where we have a general ophthalmologist, Dr. Harrison, and we are now developing a new location over in the Charlottesville area.
That is great. And of course, you guys have a huge selection of fashion eyewear, contacts, just run the gamut in terms of the things that you offer. Thank you so much for being with us this afternoon. You may have originally known them as Augusta Eye Associates, but as they have grown, they changed their name to I1 to match their growth beyond the 4 locations in Augusta County. Stay with us.